In this video I'm going to talk about the junctions of the GIT, and I'm going to start with the Pyloro-Duodenal Junction. The Pyloro-Duodenal Junction is formed of two components, which are the pylorus and the duodenum. And here we see the gastric pits of the pyloric region. They are considerably deeper than those found in the fundic region. They form about 3/5 of the thickness of the mucosa. In here we see their depth, and in here we see the transversely cut villi of the duodenum, which denotes that this is the part where the junction between the two regions starts. It is a very characteristic feature, the transversely cut villi, and this slide. As we see here, this is the lining epithelium of both regions. We may find some debris found in the slide due to the longitudinally cut section. Here is the thickness of the intestinal of the gastric pit. Also the transversely cut villi. The second junction is the Gastro-Oesophageal Junction. The Gastro-Oesophageal Junction is formed of two components. The first component is the gastric component. So we see the gastric epithelium in the form of gastric pits. Gastric pits of the cardiac region that just follows the esophagus is very much resembles that which is found in the fundic region, in the aspect that the gastric pits are not as deep as those found in the pyloric region. They only occupy about 1/5 of the submucosa. As we continue, we will find more and more gastric pits. The only way to identify the presence of the esophagus is to notice this junction. This junction means that there is a point of transition between the gastric epithelium and the esophageal epithelium. The esophageal epithelium is formed of stratified squamous epithelium, while the gastric epithelium is formed of columnar epithelium. This junction is the only thing through which we may diagnose that this is the junction slide. Another thing that is very important is the presence of the submucosal esophageal glands. They are very characteristic of the submucosa of the esophagus. If we find these two findings, we may make sure that this is the junction slide. So we see the mucosa of the esophagus, the mucosa of the stomach, and the submucosal esophageal glands. The third slide is the recto-anal junction. The recto-anal junction is the junction between the rectum and the anus, or the anal canal. The rectum is formed of colonic epithelium, or epithelium of the large intestine. It is formed mainly of test tube shaped crypts that contain goblet cells. Thus they appear to have a pale center or a pale interior. We see here many crypts, and under the mucosa we see the muscularis mucosae. There are no special structures in the submucosa that we can notice. In here this is the junction between the large intestine and the anal canal. In this junction there is a transition of epithelia from the colonic epithelium or the columnar epithelium to the epithelium of the anal canal, which is stratified squamous epithelium with keratin. This is a sebaceous gland, and the muscle we see in here is very characteristic. It is the external anal sphincter. So these are the characteristic features of this slide, and here we end all the junction slides. Thank you very much.